Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hello, everyone. I'm Dr. Mary Ann Pinkston. This is The Better Life with Dr. Pinkston. Today, as always, each month I bring you the great Ray Solano from PD Labs up in Cedar Park, Texas, my good friend and mentor and peer and everything else that has worked with me for years now and joined me on the podcast. Ray, we've been doing this for 4 years. Can you believe that?
Well, I'm looking through the old records, and gosh, we touched all the subjects, and you know what? We have the same theme: innovation,
right?
Therapeutics that make a difference in people's lives, and health tips that last the test of time.
This is true. Absolutely. And today will be absolutely no different, which you brought up a great topic for us for today in topical peptides, because as we know, even as we speak, there are meetings going on in Washington, I'm sure, that are about peptides. And finally, we're opening the gate and releasing these wonderful, peptides that change lives and do great things that are more natural to our bodies than pharmaceuticals. And so that's happening as we speak. And I know you are on top of it, as always, and have some new news and some new things going on.
Well, and as usual, it's ever changing. And when it deals with the government, Jim Laval is presenting this week in front of his presentations for the safety and the efficacy of this classifications of amino acids that have taken the medical community by storm. And unfortunately, the government has created its own black market.
Yeah.
And so we have injectables that are being sold for research only, that are being used for humans.
Yes.
Nobody would have ever thought 10 years ago that would be allowed in today's medical care of restrictions of the medical supply. However, we're having injectables flooding the market from anywhere. We have no idea where they're coming from.
Absolutely.
And unfortunately, it has caused a lot of difficulties because people say, well, they don't see the harm of it, but unfortunately, we haven't seen adverse events that have been catastrophic that you would expect. So that tells us the products are safe, but we have to make sure there's something in them at the same time, because you could make a lot of saline water.
Exactly, and sell it for a great price and do very well while not doing anything for anyone else. That's for sure.
Counterfeit medications of even Ozempic and tirzepatide and GLPs are out there.
Yes.
So to think that there's not counterfeit peptides, I think you have to be a little naive. Yes. So I think the most important thing is the regulatory of this industry to be able to go to state licensed pharmacies and facilities is what the whole the goal of this week's meeting. We'll see if it occurs, because unfortunately, if allow state licensed pharmacies to be able to make these medications under proper classification, it opens up a huge floodgate of injectables, all different formulas that they want to have control of. So we'll see how this, but again, this is just an advisory committee.
Yes.
This is a recommendations. The actual agreements for the proper classifications for these maybe many months off.
Right.
However, we have some good news.
Yes.
We've got a the ability to come up with these special peptides that are in the reclassification nominations as we speak.
Right.
And we figured out how we can do it as injections. I mean, non-injections, transdermally. We've been working on it for 2 years now, and we're ready to launch it this week, that are transdermal. And this is one of the classifications will be much easier for oral and transdermal as opposed to injections. Less risky, less complications, less stability concerns. So we're ready to launch these because people are getting fatigued from peptides. I don't know. You could take 6 or 5 or 6 a day injections. What a pain in the neck, right?
Absolutely. To say the least, no pun intended, right?
That's right. So we've developed in partnership with a pharmaceutical manufacturer a special high molecular weight base for exclusively that works with peptides to get these ingredients past the stratus corneum layer. Okay. And the good news is it gets absorbed super fast. And you may have to have applications twice because it clears so quickly.
Right.
But we've developed one for pain that gives relief very quickly, especially nerve pain. I mean, you know is how many people to get rid of tendons and neuropathy or strains of certain joints. That's why do you have to take a whole pill for the whole body, right?
Right.
So applied even naltrexone, right? Low dose naltrexone, applied topically with a special peptide affinity for the nerves to stop inflammation of the nerves. It works within minutes. Can you imagine that? It's topically, something that's an FDA-approved drug, naltrexone, for pain, topically, and gets absorbed fast. And this is the beauty of this special derm base that we've developed that's exclusive to PD Labs. And just think of the possibilities. Once we get this in your hands, Dr. Pinkston, you're going to come up with, what about this? What about this? What about this?
My brain is going already, and I love it. So we'll good. And maybe explain. There's 2 things because I've got a well-versed audience, and I love the integrative nature of my audience. Very educated, but there's a reason why using topicals. So anybody can get a topical. I mean, there's topicals all over. There's for your cosmetic reasons, for face, right, for pain, for things like that. And so why is a base so important, and what you guys have worked on been so hard to come up with, and why is that so important?
Well, traditionally peptides, when they come as special lyophilized powders that are stable, and they have to be reconstituted. And once you reconstitute them with a water and when you make an injections in special sterile water, they start to degrade, and the time starts that they lose its potency over time, and they have to be refrigerated, and it seems to cause a problem. And the only way you can't take them orally because the stomach acids denature some of these, and so you're left to injections. But there are ways to encapsulate these molecules and be able to have a super high affinity to pass through the stratus corneum and the 5 different layers of the skin, because the body has tremendous capillaries in the skin. So if you can get absorbed to those capillaries, right, and locally absorption, you've come up with something miraculous. We all know. We've heard of DMSO, okay? Mm-hmm. And DMSO gets absorbed so fast that you can taste it within minutes. So the point is that there are chemical structures and there are ways to get through those small there's these junctions in the skin to get through them to right to the capillary beds. So this is what we've done, is being able to use the same formulations that we do for hormones. Topical hormones have been used for tremendous many, many years. Some critics believe it just doesn't get absorbed, but we know differently. It's the right concentrations and the base makes a difference. So this special derm base is very stable for peptides. It doesn't allow them to, it keeps them active and doesn't denature them. So we've used it with successfully with BPC 157. We've used it with the naturally occurring peptide of MOTC, which is naturally occurring in the body. BPC is naturally occurring in the GI tract. So we're taking some of these natural amino acids and being able to apply them to the skin. SS31, some of these are FDA approved peptides. And we think that we can have the ability to a whole different mechanism of action to help people. And especially with cosmeceuticals, to be able to get rid of the upregulate collagen production. This is the big thing right now with the Ozempic faces, to be able to take GHK copper and be able to upregulate the collagen and fill in those fine lines, those crevices in the skin. So this is what we're slowing the aging process. We're increasing energy for the mitochondria, upregulating it to give them the fertilizer, so to speak, to get the body to make that energy. So this is really is something that we can apply twice a day. It's moderately, very economically. So we're really we're going to be launching it this week.
That's great. And so spend a moment on BPC. I had my husband had a nephew that, was inquiring, just had surgery for orthopedic surgery. And, had questions about using BPC and wondered if I could provide, a prescription for an injectable. And I said, no, not yet. And he said, well, it's available all over the internet. I said, yeah, and that proves to your point right there about, the black market. It is everywhere and you don't know what you're getting and it isn't safe. And so I encouraged him not to, delve into that and allow himself to be taken advantage. And so we talked about the LPT form of BPC, but a topical. So something, the oral form I think is great for the GI tract. I think it's a good, GI tract repair for leaky gut and things like that. But the topical even makes sense to me in a lot of ways over the injectable, honestly, for, orthopedic type surgery, like you say, tendonitis and joint pain and things like that. So it makes beautiful sense. It would be a great adjunct for him to use, I think.
And we think that, there are some state licensed pharmacies that are making the BPC 157. So it depends on a state by state basis. Right. The oral LPTs are a lipid particle technology, which assimilates an injection, and it works very well. But you have to chew a couple of them a day. But just think about taking that orally and topically as well. And again, peptides are signaling, just people to understand.
Yes.
They're not drugs.
Yes.
There's signaling mechanisms that signal the body to go to an area to heal. Right. So they work. That's what the beauty of peptides are, is they work in concert with the body and be able to accelerate the connectivity between different metabolic areas of concern, especially inflammation, especially energy production. So this is what we really have the potential for doing. But topical BPC in combination with these, we're still working on the the single layers, the single ingredients. Mm-hmm. But once we start bundling these together, right. I think we're probably going to see a whole different layer of therapeutics. Absolutely. But just think about, what do we have for for neuropathy pain right now?
Not much.
Gabapentin, right?
Right. Yeah. Yeah.
And you could tell somebody's on gabapentin because they start looking at the sky and start, every once in a while, they think that they're catching butterflies in front of their eyes.
It's sleepy and just you're right. Almost delusional sometimes. So
it is. And they start, I remember seeing a pharmacist that was on gabapentin and started labeling their lab coats instead of the prescription bottles.
Oh my goodness.
You're taking too many drugs when you start labeling your body instead of, and you're missing the bottles.
Absolutely frightening. Yeah.
But this is the choices we have for pain, the choices we have for inflammation, the choices that we have for improving skin over time is such it's almost it hasn't changed in 20 years.
Right.
So this is why we're really excited in combination therapy, that we can have lots of choices for people, because Tetracure with a high potency curcumin and BPC is an alternative to pain medications.
Right.
Because, pain medications just don't improve healing. So that's what we're looking to, is improve healing.
And I think you bring about a good point that the body is fully, and I say this many times, the body is fully capable of handling what it needs to handle with inflammation, pain signals and whatnot. But when it gets into overload and can't be controlled, we can signal the body to do its job and overcome that as more of a root cause, right, and more of almost a natural way of treating. And that's what, again, like you said, to reiterate that, that's what the peptides are doing. They're helping your body overcome it and do what it's supposed to do.
That's right.
Beautiful.
Yeah, it makes it really simple.
Absolutely.
So we're excited to roll this out. You can check out our website, pdlabsrx.com, and we have clinical pharmacists that are there to answer questions for you and how to get some of these novel compounds. And it's all of our, we're licensed nationwide, so we're really accessible. And the big thing is we have people that are trained to answer the phones and answer those questions. So that's the advantage that we have to offer. Especially, these are new compounds. It requires a little bit of training and a little bit of understanding, because the dosing is, to be honest with you, is going to change from month to month. Once we get data from your patients and we get patients, we understand what the applicability is, especially for children, to healing some of these gut issues for children. It is the portfolio or the formulary for the drugs for children and for the elderly. It's pretty slim with the side effects, right, especially the seniors. We just, their livers are not able to handle some of these drugs.
True. On both ends, the young and the old.
Young and old. So
the pharmacy and the old, and just the inability of the body to handle these loads that we give them. And so I would love to run through a list of what is offered. I do want to step back for a moment and let people see the commercial that you have so they can understand PD Labs a little bit more and know when to contact you. But if the people stay tuned for a moment, we can run through and get the list of things that are available. And it's as long as my leg. I love it. So hang on for just a moment. We'll run PD Labs commercial and be right back.
Hi, this is pharmacist Ray Solano with an important tip to save you money on your prescriptions. Imagine affordable medication and programs that get rid of the root cause of chronic conditions, such as elevated blood sugar, blood pressure, and difficulty remembering your keys, or maybe even where your car is. PD Labs Pharmacy is a special compounding pharmacy providing service, solutions, and access to on-site trained telemedicine staff available to answer your questions. Today, many people have discovered personalized prescriptions tailored to you with powerful results such as feeling better. Check out our website, pdlabsrx.com. Our nationwide coverage and 26 years in pharmacy allows us to offer medications at almost half the price of local pharmacies. Switch your pharmacy to PD Labs and experience the real service without the expensive bill. Call us at 888-909-0110. That's 888-909-0110 or pdlabsrx.com. Remember, you have a choice in healthcare.
Dr. Marianne Pinkston here, back with Ray Solano from PD Labs, who you just witnessed. I love the fact that not only do you provide compounding solutions, but you also provide pharmaceutical solutions so people can move over and do, accomplish both of their feats and be taken care of, well taken care of than the big name pharmacies that are out there. So we appreciate that, Ray. And we are discussing the topical peptides, and I know there's a laundry list of things that are offered, but let's run through them because I want people to know how wide this availability is and what they can get.
Well, the list is evolving as we speak, and you can check out some of the updates on our website, pdlabsrx.com. And it also sees a video of our new complex in Cedar Park and our new facility and our new lab. It will be listed on our website and video. But the ones that we are going to be launching is the peptides. We're exclusively for one of the ones that we're really excited about is energy.
Yes.
One of the ingredients is that we used to use as injections, some of the amino acids that are similar to MOTC. So it's what we have found is there's some of the natural occurring amino acids that have the same efficacy as the MOTC for energy is something that we are excited that for the results that we're seeing with patients that are they're upregulates the mitochondria to make more ATP production. So it's a topical energy for peptides that works, applying it twice a day. Nice. There's another one. There's a amino acid that's similar to DSIP as well for sleep. It upregulates melatonin production and gives people sleep effects. This is something that's been on the market for quite a long period of time, and apply it topically. And so we're excited that for the results that we see for that for sleep. So it's a transdermal topical for sleep that has those same amino acids like a DSIP. And then there's ones that increases growth hormone levels. That the kisspeptin and CJC that is similar. Again, we're taking amino acids in the same family as some of these group of peptides that have that same effect for increasing. As we age, our growth hormone levels from our pineal gland it seems to decrease, and these glands don't make enough. So we were trying to upregulate them to normalize. So that is one of the ones that we have had positive results with. And then the biggest thing is the BPC 157, which it's a naturally occurring peptide. It's been on the market for 20 years and applied topically for tendons and also for nerve pain. This is easily to be in conjunction with naltrexone. Easily can be used in conjunction with curcuminoids. Applied topically has an instant effect to reducing swelling.
Right.
That's what we're really excited. It reduces that inflammation very, very quickly. So this is with the transdermal BPC 157. And then the other ones that we're still working on is the topical VIP, vasoactive intestinal peptide that we use as a nasal spray.
Right.
That we feel is a potent vasodilator. Okay, it's an FDA approved drug that categorized. We're able to use it for pulmonary hypertension. Has a very profound effect, and right now it's been in a nasal spray and an oral tablet, but we think it has potential topically as well for dilation of that. So those are the ones that we're going to have out of the gate this week, and the combinations are endless, because you're going to come up and say, I think we need this here, we need this here, why can't we do this one here?
Right.
And then just think about it. You could put some of these together with estrogens, okay, for the skin. That is something that we are definitely putting the GHK copper with estrogens to rebuild those reduce those wrinkles.
Absolutely.
Low estrogen levels is premature wrinkling.
Right.
So that's what we have, that once we able to get this, we can pair them with other drugs as well, that to really target an area.
You have hair loss, the libido. Can you address features like that?
Yeah, the hair loss. We're using a OS01, a small molecule that we have been able to use as a skin serum that reduces the wrinkles in the skin. And like I said, it all these things, anything we can as we increase collagen production. But in topical with 4 or 5 or 6 other peptides has been very effective for skin appearance.
Yes.
But we actually add it with caffeine and other ingredients for a hair serum.
Nice.
That we're still finalizing the right formulation, because once hair serums, we want to make sure it does not cause discolorations, and it doesn't want to be oily. So, but it really makes a difference in upregulating hair growth. So we're very excited about the OS01 in a hair serum, and it can be used with minoxidil. Okay. A lot of women are positively affected with minoxidil, but they're spotty effects. Right. So what we're finding, that we sandwich these together and we layer them on top of one another, and we have a pretty potent cocktail for hair restoration. Yeah. There's not to say that you have to have adequate B vitamins at the same time orally. So it's important to get with a practitioner.
Yes. To
put all these together.
Yes, absolutely. Absolutely. And your gray hair is gone. I still see you look as young as.
Well, you can, and I use the topical glutathione.
Yes.
Palmitate with vitamin C. I use on my skin and hair, and it's an antioxidant. Okay. Yes. So when you put potent antioxidants together with peptides, it reverses the aging process. And gray hair is a high level of peroxidase, right? That occurs. Yep. So you can reverse some of the grayness. And something I use daily. So I think that, as we age, graying, 50% of the population is over 50. Yeah. So gray is in, but maybe not as much gray. How's that?
I say it may be in, but it's definitely not enjoyable. I think it's in because it has to be. And so
that's right.
You feel like it has to be, but it doesn't. You just heard that yourself. I had a huge, I can't tell which side. I think it's this side, a huge patch of discoloration, skin discoloration, aging and sun features and whatnot. And I tell you what, yep. And with your topicals, the OS01 and,
right.
it is gone.
Right. That's a very it's one of those skin conditions that just kind of creeps up, and people just is something that is very difficult to reverse. Yeah. And yes, I've had some of that myself, and topical antioxidants is a great way to reduce skin exposure from radiation that we get on a daily basis. Our face gets the most of it, our face, hair, our ears and nose. So to me, I think it doesn't have an SPF factor to it. Right. But what are we doing? We're stopping the oxidation of cells. If you can slow the oxidation of cells, you are, in a sense, preventing you're getting the absorption of the vitamin D and not getting the positive effects of sunlight, but you're stopping the burning or the oxidation of skin cells. So that's, as we age, our melanotan pigmentation, we don't make as much. So we end up getting a little bit grayer, so to speak, our skin. But it's really important that we upregulate these naturally occurring peptides in our skin that stop the I would say the oxidation of these skin cells, which cause melanoma and many of these skin cancers that we are faced with when we get older. So that's some of the things that when you start thinking about it, wow, these peptides are just an amazing formulary of new products. So we're excited about the future. I don't think you're going to turn this around and go backwards. Right. It's just going to have to be a little bit more regulated, so you know what you're going to get, right? And be able to something that just make people look a little bit better.
Absolutely. And I don't know, for those of you not on YouTube, you can't see the smile on my face of excitement from all of this, because this is wonderful. I mean, really, this is wonderful. So if you're not familiar with peptides, if you're not familiar with the root cause and root healing that is provided by peptides, and just how wonderful these, amino acids are to our bodies, and the safety. I hope we've touched on that enough, because the safety and efficacy is truly there. And Ray has, worked diligently for many years now to try to provide this in a responsible, safe manner that actually works and does the job it's supposed to do. And so we thank you for that. And so what have we missed, Ray? Is there anything underneath that we have left off?
Well, I think one of as we get swept up, you're going to see by the end of the week, you're going to have a tsunami of peptide media blitzes. Because right now, as going on right now, Jim LaValle they're in a press conferences. The FDA is holding press conferences on this. But let's think about this for a second. You cannot reverse bad habits of health with a single drug or a single peptide or a single anything. It's going to take lifestyle changes. So it is a tool, that is I would say almost the cherry on top of the sundae. You've got to be able to do the other things. You've got to change the diet and get rid of those processed foods that probably should never been around forever. We those are the things that we can't do without. We have to be able to change our lifestyle habits and what we do. That everybody's different, but it's so important that if you've had those fundamental problems with high blood pressure and you're overweight by 50 to 60 pounds, you've got to address that together, because that is your body's out of tune. So right now you've got so many tools to be able to do this more than we've ever seen. So there's more hope than ever. So we need an integrative practice like yourself, and you've got trained nutritionists and trained practitioners that can change hormone levels. Okay, because now hormones are safe, right?
Finally address the truth here. Hormones.
So I think that it's kind of a renaissance in healthcare. And unfortunately, the one that's holding it back is the regulatory. So we'll see what happens, but it's really important that people realize it's a combination therapy. And taking a bunch of injections is not going to be able to change your actual love for fast foods 3 times a day. I'm sorry.
Right. Yes, absolutely. You are so correct. Absolutely. Absolutely.
So,
well, good. Well, thank you for addressing that, because that is the ultimate truth. And so the tools are great. You know, we talk about it in weight loss all the time, especially with GLP. You know, it's a great tool. It is not the answer. It is a tool to helping you find the goals that you are trying to attain. But underneath, good sleep, lifestyle, you know, eating correctly, exercise, all of those things, living well, being responsible and accountable for all of those things. Thank you.
That's right. So I think we've got a good formula. What do you think?
I agree wholeheartedly, and I'm very excited. So yes, I've been on board with this. I've been using some of them. I'm glad that there's more out there. We'll definitely take advantage. And for all of you who want to take advantage, Ray, please tell them where they can find you.
Yeah, check out pdlabsrx.com. It's pdlabsrx.com. And we have a unique research-based formulas that nobody else has for men's health, erectile dysfunction that nobody else has. We have a tremendous amount of one-of-a-kind supplements that are absorbed, that are chewable. So even for the elderly that may not be able to swallow pills, but even more, almost rival the effectiveness of injections. Right. So these are things that we're able to offer, and we ship nationwide, and we turn around things usually within 1 or 2 days, sometimes same day service. So give us a chance.
And please check out our previous shows that we have done monthly for 4 years now at drpbetterlife.com. You can also reach out to Ray there. I've got all the links. So you just find the number, the links for PD Labs at drpbetterlife.com. And Ray, until next time, I appreciate you always. And I hope that you have a great rest of your week. And we send lots of positive vibes to Jim out there. And
that's right.
That's working hard.
Yeah, I think it's important to read the headlines, sniff the headlines, I should say, and let's see if we can read between the lines, and that's what we're all about. We're not about fads. We'd like to get to the truth, and this is what your show is about. Let's get to the facts so that we can build on it, because people's lives depend on it.
Absolutely. Well said. Thank you. I appreciate that. All right, guys, everybody, have a great rest of your week. And remember, take care of each other out there.
All right. You've been enjoying The Better Life with Dr. Mary Ann Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.